This video reflects users, caregivers, and a clinician's experiences with Peristeen. Coloplast invited these people to share their stories and provided compensation for participation in the video. Each person's situation is unique. Your experience may not be the same. Talk with your doctor about whether this product is right for you.
Chronic constipation and fecal incontinence associated with neurogenic bowel can have a significant impact on the quality of life for both children and adults. Peristeen allows you to take back control of your life. Peristeen works by pumping tap water into the colon to help clean out the lower portion of the colon from stool. This procedure takes about 30 minutes and allows the child or adult to usually go an average of 2 days without fear of a bowel accident. Peristeen has several advantages. It is portable. It's also easy to use by both children and adults. Of course, there is a training and an adjustment period to become comfortable with using the device. But once you're comfortable using the device, you're now in control of your bowels and are the boss as to when your bowels are going to empty and where.
Is that a good ride?
Sophia is 5 years old. She's very energetic and fun-loving. She loves to play, have friends, and just be with people. I think one of the main reasons an effective bowel program was important for us was that with the current program that we were using, Sophia was having a lot of bowel accidents, multiple sick days, and my husband and I were just concerned overall for her long-term health.
So how has Peristeen made a difference for your family?
Well, we no longer dread the bowel program. We now have a very self-confident little girl who's not worried about having accidents. And I think most importantly is that hopefully in the future we're going to avoid a very large surgical procedure to attain bowel management.
So what have you done to improve your process?
The first thing we did was we tried doing the bowel program at the same time each day. And for us, that was in the evening, after dinner. The other thing that we've taught Sophia is because she doesn't have sensation, once she's off of the potty, if she hears something or she smells something, she needs to alert mom and dad. And when she does, we give her a lot of praise for that.
You know what?
I would tell families that are going to start Peristeen that stick with it, be consistent, encourage your child, and talk with other families. Get an idea of what's worked for them. When you start any type of new bowel program, there's bound to be accidents. But what I can tell you as a mom is that when we started the Peristeen, after we stuck with it for a few weeks, we saw that the frequency of accidents was far, far less.
As we get older, we know that quality of life, independence, and self-esteem are ever more important. Having bowel accidents can have a significant impact on the quality of life that you're living. Bowel accidents can often happen at the most inopportune time. Peristeen can allow you to have better control of your bowels, hopefully eliminating bowel accidents and allowing you to go for up to 2 days without any accidents at all. We know that if there's no stool, there's no worry, and there's no accidents. So can you tell us a little about how Isaac was diagnosed with neurogenic bowel?
Yes, he was diagnosed in 2011 with Ewing sarcoma. He had a tumor in the waist down. He lost feeling. He became paraplegia. So with that came along with the neurogenic bladder, neurogenic bowel.
So Isaac, what types of things did you try to help manage your constipation and fecal incontinence?
We've tried stool softeners. We've tried cone enema, but they weren't really helping control my bowel movements.
What has using Peristeen every day meant to you in your life?
It means a lot. It changed our lives for the better. We've came a long ways with, different bowel movements products, and I can say Peristeen is the one for us.
So Isaac, what would you tell another teenager who's thinking of starting Peristeen?
I think I say give it a try. It really helps control my bowel movements, and it gives me the confidence to go outside and enjoy everything without having embarrassing accidents.
Peristeen is not for everybody, but if you are a good candidate for this therapy, my suggestion would be to try it. Be patient with it, create a routine. Don't give up. Peristeen allows you to take back control of your life. Peristeen allows you to manage your bowels rather than your bowels managing you.
Peristeen empties the bowel by introducing water into the bowel using a rectal catheter. The anal irrigation procedure should always be carried out with care. Bowel perforation is an extremely rare but serious and potentially lethal complication to anal irrigation and will require immediate admission to a hospital, often requiring surgery. This treatment is prescribed by your physician. Although many patients benefit from the use of this device, results may vary. Discuss the treatment options with your physician to understand the risks and benefits to determine if Peristeen is right for you. For further questions, call Coloplast at 1-855-605-7594 or consult the company website at www.coloplast.us.